very wonderful evening to you and welcome to your program, my program, Touch on ITV. I am Neka Alishaba.
So, Musa Abdulkadir Tabari, the Chief Medical Director, Barodiko Teaching Hospital here in Kaduna. About Lassa fever, yes, it is all known to everybody, virtually all Nigerians now, that Lassa fever is with us. It started in two major states, Ondo and Edo, that were badly hit with this scourge of Lassa fever infection. Now it has now reached to this part of the country in northern Nigeria. So far in Kaduna State, we have recorded one case that has been confirmed, and of course, and we've been getting continuously suspected cases, which we've been taking sample and sending it to Abuja for the National Reference Laboratory for testing. Fortunately, all the samples we sent, they used to come back as negative. So, but we will continue to keep surveillance on SARS for this deadly disease. Now, Lassa fever generally, usually, it occurs within this type of time of the year, between November and up to towards March, about 5 months in the year. That's when we see the emergence of this type of infection. It is actually a viral hemorrhagic febrile disease, which means it is caused by a virus, which is a microorganism. And that microorganism, and also as part of it, as the name implies, hemorrhagic, which means it causes hemorrhage, bleeding. Whoever is affected with this disease, you see the person will start manifesting with bleeding. Before the bleeding, there are so many other minor symptoms, just like fever, body weakness, all symptoms that are associated with malaria and other infectious diseases. Usually it starts with that one. So which means we should try as much as possible whenever we started feeling symptoms. We should, the general public is here being called to be going to the hospitals so that they will be checked, look at upon to, and then be advised appropriately. Then coming back to Lassa, when it happens, usually when it comes to the hospital, and then even before and after the diagnosis in the hospital, we have some protective measures for the health workers. And then on the other side of it, we also have protective measures for the public. For the health workers in the hospital, there are personal protective equipment that is being provided for patients, for health workers. And then again, we also provide some attitudinal working environmental changes, which means both the environment and then the attitude towards handling patients also. There's a way we enlighten our staff so that they should be able to take care of themselves. Because why we are having putting more emphasis on staff, is because, when this patient, when they arrive, they first come into contact with health workers. So, and then most of the mortalities or the death we are witnessing as a result of this coming into contact with these infected patients by our health workers. Therefore, we put more emphasis on the protection of our workers. Then, to the public, the protective measures are two ways. Number one, if you don't have any business of coming to the hospital, especially in this time of period, you don't need to come. All what we are saying is you should come when there is need for you to come to the hospital, perhaps when you need a medical consultation in the hospital, then you must come. Or you must be the one to accompany the person seeking for medical attention. So that one, there's every reason for you to come to the hospital. But unnecessary visits to the hospital, some of them will just combat the hospital environment as a form pair environment, or sometimes you even see patients coming to just struggling to have a glimpse of how does a Lassa patient looks like. I mean, patient relatives, people from the public, they disturb us in the hospital, trying to see, have a glimpse of who or how does a Lassa patient looks like. In fact, even if they come, if we have a case of Lassa, you'll never see one. More so because we isolated them in a secluded area within the hospital. Nobody is allowed to go in. So that is one aspect of public enlightenment campaign that we are doing. Secondly, about personal hygiene and environmental cleanliness. Okay, personal hygiene, always we're imploring people to always be washing, cleaning their hands. Make sure they use soap detergent to wash their hands all the time, especially when they touch filthy surfaces. Then again, when you are sneezing, if you are sneezing, also rather than using the palm or the back of your hand, you should use inside your elbow, or you have a handkerchief or a tissue paper, something like that, to sneeze over. Even coughing, these are all some of the measures. Again, when you have a cut, a wound, or anything like that, quickly rush to the hospital. And when you see somebody having symptoms, all the telltale signs, that symptoms that we have said, so somebody near you, ensure that you quickly transfer the patient to the nearby hospital for proper evaluation. Then our environmental hygiene. You know, this Lassa fever is caused by rats, and any rat you see we incriminate it. Of course, there are particular types of rats that cause this, but you will not be able to, as a layman, one will not be able to differentiate which rat and whether it's this rat X or rat YZ that causes this. So therefore, we implicate all rats that are capable, that are responsible for causing this Lassa fever. So anything that we are supposed to do to clear our environment so that they will be free of these rats, this is what we are calling upon the general public to take note. And we should keep our environment clean as much as possible. Thank you very much.